Hello, my name is Catherine, and I am reading to you from the book The Power of Positive Thinking by Norman Vincent Peale. We're doing Chapter 11, Part 1, How to Use Faith in Healing. Is religious faith a factor in healing? Important evidence indicates that it is. There was a time in my own experience when I was not convinced of this. But now I am, and that very definitely. I have seen too many evidences to believe otherwise. We are learning that faith, properly understood and applied, is a powerful factor in overcoming disease and establishing health. My conviction regarding this important question is shared by many medical men. Newspapers carried an account of the visit to this country of the famous Viennese surgeon, Dr. Hans Finsterer. I quote the newspaper story, which was headed, "On a Surgeon Guided by God." A Viennese doctor, Dr. Hans Finsterer, who believes the unseen hand of God helps make an operation successful, was selected by the International College of Surgeons for its highest honor, Master of Surgery. He was cited for his work in abdominal surgery with the use of local anesthesia only. Finsterer, 72-year-old professor at the University of Vienna, has performed more than 20,000 major operations, among them 8,000 gastric resections, that's a removal of part or all of the stomach, using only local anesthesia. Finsterer said that although considerable progress has been made in medicine and surgery in the past few years, all advances are not sufficient in themselves to ensure a happy outcome in every operation. In many instances, he said, in what appeared to be simple surgical procedures, the patients died, and in some cases, where the surgeon despaired of a patient, there was recovery. Some of our colleagues attribute these things to unpredictable chance, while others are convinced that in those difficult cases, their work has been aided by the unseen hand of God. Of late years, unfortunately, many patients and doctors have lost their conviction that all things depend on the providence of God. When we are once again convinced of the power of God's help in our activities, and especially in the treatment of our patients, then true progress will have been accomplished in restoring the sick to health. So concludes the account of a great surgeon who combines his science with faith. I spoke at the National Convention of an important industry. It was a large gathering of the leaders in an amazingly creative merchandising enterprise that has established this particular industry as a vital factor in American business life. I was somewhat surprised when one of the leaders of this organization at the convention luncheon, where the discussion centered around taxation, rising costs, and business problems, turned to me and asked, "Do you believe that faith can heal?" There are a good many well-authenticated examples on record of people who have been healed by faith, I answered. Of course, I do not think we should depend on faith alone to heal a physical ailment. I believe in the combination of God and the doctor. This viewpoint takes advantage of medical science and the science of faith, and both are elements in the healing process. Let me tell you a story, the man continued. A number of years ago, I had a malady that was diagnosed as osteoma of the jaw, that is, a bone tumor on my jaw. The doctors told me it was practically incurable. You can imagine how that disturbed me. Desperately, I sought for help. Although I had attended church with fair regularity, still, I was not a particularly religious man. I scarcely even read the Bible. One day, however, as I lay in my bed, it occurred to me that I would like to read the Bible, and I asked my wife to bring one to me. She was very surprised, for I have never before made such a request. I began to read and found consolation and comfort. I also became a bit more hopeful and less discouraged. I continued to read for extended periods every day. But that wasn't the chief result. I began to notice that the condition which had troubled me was growing less noticeable. At first I thought I imagined this. Then I became convinced that some change was taking place in me. One day, while reading the Bible, I had a curious inward feeling of warmth and great happiness. It is difficult to describe, and long ago I got over trying to explain the feeling. From that time on, my improvement was quite rapid. I went back to the doctors, who had first diagnosed my case. They examined me carefully. They were obviously surprised and agreed that my condition had improved, but warned me that this was only a temporary respite. Later, however, upon further examination, it was determined that the symptoms of the osteoma had disappeared entirely. Still, the doctors told me it would probably start all over again. This did not disturb me, for in my heart I knew that I was healed. "How long has it been since your healing?" I asked. 14 years was the answer. I studied this man. Strong, sturdy, healthy. He is one of the outstanding men in his industry. The incident was told to me in the factual way that a businessman would recount it. There was not the slightest indication of doubt in this man's mind. Indeed, how could there be? For whereas he had been condemned to death, here he was alive and vigorous. What did it? The skillful work of the physician, plus. And what was the plus? Obviously, the faith that heals. The healing described by this gentleman is but one of many similar accounts, and so many of them are attested by competent medical evidence that it seems we must encourage people to make greater use of the amazing power of faith in healing. Sadly, the healing element in faith has suffered neglect. I am certain that faith can and does work what we call miracles, but which are, in truth, the operation of spiritually scientific laws. There is a growing emphasis in present-day religious practice, which is designed to help people find healing from the sickness of mind and heart, soul and body. This is a return to the original practice of Christianity. Only in recent times have we tended to overlook the fact that for centuries, religion carried on healing activities. The very word pastor derives from a word meaning the cure of souls. In modern times, however, man made the false assumption that it is impossible to harmonize the teachings of the Bible with what is called science. And so, the healing emphasis of religion was abandoned almost entirely to materialistic science. Today, however, the close association of religion and health is increasingly recognized. It is significant that the word holiness derives from a word meaning wholeness, and the word meditation, usually used in a religious sense, closely resembles the root meaning of the word medication. The affinity of the two words is startlingly evident when we realize that sincere and practical meditation upon God and His truth acts as a medication for the soul and body. Present-day medicine emphasizes psychosomatic factors in healing, thus recognizing the relationship of mental states to bodily health. Modern medical practice realizes and takes into consideration the close connection between how a man thinks and how he feels. Since religion deals with thought and feelings and basic attitudes, it is only natural that the science of faith should be important in the healing process. Harold Sherman, author and playwright, was asked to revise an important radio presentation with the promise that he would be contracted as the permanent writer. After some months of work, he was dismissed and his material used without credit. This resulted in financial difficulty and humiliation. The injustice rankling in his mind developed into a growing bitterness against the radio executive who had broken faith with him. Mr. Sherman declares that this is the one time in his life when he had murder in his heart. His hatred made him subject to a physical affliction in the form of a mycosis, a fungal growth which attacked the membranes of his throat. The best medical attention was secured, but something in addition was required. When he gave up his hate and developed a feeling of forgiveness and understanding, the condition gradually corrected itself. With the aid of medical science and a new mental attitude, he was healed of his affliction. A sensible and effective pattern for health and happiness is to utilize the skills and methods of medical science to the fullest possible extent and, at the same time, apply the wisdom, the experience, and the techniques of spiritual science. There is impressive evidence to support the belief that God works through both the practitioner of science, the doctor, and the practitioner of faith, the minister. Many physicians join in this point of view. At a Rotary Club luncheon, I sat at a table with 9 other men. One of them was a physician who had recently been discharged from military service and had resumed his civilian practice. He said, "Upon my return from the army, I noticed a change in my patients' troubles. I found that a high percentage do not need medicine, but better thought patterns. They are not sick in their bodies so much as they are sick in their thoughts and emotions. They are all mixed up with fear thoughts, inferiority feelings, guilt, and resentment. I found that in treating them, I needed to be about as much a psychiatrist as a physician. And when I discovered that not even those therapies helped me fully to do my job, I became aware that in many cases the basic trouble with people was spiritual. So I found myself frequently quoting the Bible to them. Then I fell into the habit of prescribing religious and inspirational books, especially those that give guidance in how to live." Directing his statements to me, he said, It's about time you ministers began to realize that in the healing of many people, you too have a function to perform. Of course, you're not going to overlap in the work of the physician any more than we shall intrude in your function. But we doctors need the cooperation of ministers in helping people find health and well-being. I received a letter from a physician in an upstate New York town who said, 60% of the people in this town are sick because they are maladjusted in their minds and in their souls. It is hard to realize that the modern soul is sick to such an extent that the physical organs pain. I suppose in time, continues the doctor, that ministers, priests, and the rabbis will understand this relationship. This physician was kind enough to say that he prescribes my book, A Guide to Confident Living, and other similar books to his patients, and that noteworthy results have been achieved thereby. The manager of a Birmingham, Alabama bookstore sent me a prescription form made out by a physician of that city to be filled not by a drugstore, but at her bookstore. He prescribes Dr. Carl R. Ferris, formerly president of the Jackson County Medical Society of Kansas City, Missouri, with whom I had the pleasure of appearing on a joint health and happiness radio program, declared that in treating human ills and the physical and spiritual are often so deeply interrelated that there is often no clearly defined dividing line between the two. Years ago, my friend Dr. Clarence W. Lieb pointed out to me the effect on health of spiritual and psychiatric problems. And through his wise guidance, I began to see that fear and guilt, hate and resentment, problems with which I was dealing, were often closely connected with problems of health and physical well-being. So profoundly does Dr. Lieb believe in this therapy that he, with Dr. Smiley Blanton, inaugurated the Religio Psychiatric Clinic, which for years was ministered to hundreds at the Marble Collegiate College in New York. The late Dr. William Seaman Brainbridge and I worked closely together on the relationship of religion and surgery, and we were able to bring health and new life to many. Two of my medical friends in New York, Dr. Zed Taylor Berkowitz and Dr. Howard Westcott, have been to inestimable help in my pastoral work through their wisely scientific and yet deeply spiritual understanding of the ills of the body, mind, and soul as related to faith. We have discovered the psychosomatic cause of high blood pressure as some form of subtle, repressed fear, a fear of things that might happen, not of things that are, says Dr. Rebecca Beard. They are largely fear of things in the future. In this sense, therefore, they are imaginary, for they may not happen at all. In the case of diabetes, it is grief or disappointment which we found uses up more energy than any other emotion, thereby exhausting the insulin which is manufactured by the pancreas cells until they are worn out. Here we find the emotion involved in the past, reliving the past and not being able to go forward into life. The medical world can give relief in disorders like these. They can sometimes give that something that can lower the blood pressure when it is high or raise it when it is low, but not permanently. They can give insulin, which will burn up more sugar into energy and give the diabetic relief. These are definite aids, but they do not offer a complete cure. No drug or vaccine has been discovered to protect us from our own emotional selves and our own emotional conflicts. A better understanding of our own emotional selves and a return to religious faith seem to form the combination that holds the greatest promise of permanent help to any of us. The answer, Dr. Beard concludes, is in the healing teaching of Jesus. Another efficient woman physician wrote me of her own development in combining the therapy of medicine and faith. I became interested in your straightforward religious philosophy. I have been working at top speed and getting tense, irritable, and at sometimes beset with old fears and guilts. In fact, in need of a release from morbid tension. At a low moment early one morning, I picked up your book and I began to read it. There was the prescription that I needed. Here was God, the great physician, with faith in him as an antibiotic to kill the germs of fear and render useless the virus of guilt. I began to practice the good Christian principles outlined in your book. Gradually, there came a release of tension and I felt relaxed and happier, and I slept well. I quit taking vitamin and pep pills then, she adds, and this is what I want to emphasize. I began to feel that I wanted to share this new experience with my patients, those who came to me with neurosis. I was surprised to find how many had read your book and others. The patient and I seemed to have a common ground to work on. It has been an enriching experience. To talk about a faith in God has become a natural and easy thing to do. As a doctor, she adds, I have seen a number of miraculous recoveries due to divine aid being given. In the past few weeks, I have had an additional experience. My sister had to undergo a serious operation about 3 weeks ago. Following the operation, she developed an intestinal obstruction. On her 5th day, she was very critically ill, and as I left the hospital at noon, I realized that she must take a turn for the better very soon, or her hope of recovery would be slim. I was very worried, so I drove slowly around for about 20 minutes, praying for a relief from this obstruction. Everything that could be done medically was being taken care of. I had not been home more than 10 minutes when the phone rang and her nurse told me that the obstruction had relieved itself and that she had taken a definite turn for the better. And since that time, she has recovered completely. Could I feel otherwise than that God's intervention has saved her life? So I'm going to stop here today, and my name is Catherine. I'll see you in the next, where I continue the rest of chapter 11 for you. Have a lovely day, and I hope this has helped. If so, please do subscribe and like.